Okay, hi, Assalamualaikum. So, previously we have talked about what are the causes of breast refusal. So now let's discuss what are the things that we can do to encourage breastfeeding for our baby who just seems to refuse breastfeeding. Okay, again, let me emphasize that usually this is temporary, but however, it may take up to a few days, weeks, and even some up to 1 or 2 months to get just the perfect latch. All right, so patience is the key. I know it's easier said than done, but patience is definitely it. And if you realize what is the importance of breastfeeding and you're just very determined to continue with it, then you can try and practice some of these tips, right, and see whether it works when your baby just seems to refuse to breastfeed. Okay, number one is to encourage skin to skin contact. Okay, skin to skin contact means to put the baby on your chest, but your chest must be exposed, all right, and then the baby must be naked as well, but of course wearing the nappies. Okay, and then put the baby on your chest, and if you're worried of being cold, then you can take a blanket just to cover on top. Okay, so do a lot of that. And in fact, if let's say you have tried to breastfeed the baby and then baby just seem to refuse to breastfeed, and you just want to calm the baby down and also sometimes to calm yourself down as well, you can have skin to skin contact. Okay, so that's good. And studies have shown there are a lot of benefits of skin to skin contact, so it's not just to help with breastfeeding, but it can also help the baby's weight gain as well, right? So number two is to encourage frequent feeding. Okay, so yeah, baby is refusing feeding, but don't give up, and try to feed as frequent as possible, and try to resist from giving any pacifiers or artificial teats. Okay, so if let's say the baby is hungry and when you try to breastfeed the baby is refusing, then you must be aware of the feeding cues. Okay, feeding cues means that these subtle signs that the baby may show before the baby cries. Okay, when the baby cries is considered as a late hunger sign already, so try to be aware of certain signs. For example, like the baby is like smacking the lips, or looking to the right and left, putting the hand into the mouth. So those are some of the signs. So at that time you breastfeed your baby. Okay, and you can even try to breastfeed baby like just before the baby goes to sleep and just after the baby is awake. So sometimes when in this golden time, then baby may tend to latch. Okay, so you can try that as well. So number three is try to wear more nursing friendly clothes, right? So so that the baby can access easily when you want to breastfeed the baby. Yeah, nursing friendly clothes meaning there's an opening in front, and wear a nursing bra as well, because babies, especially the older ones, they get very impatient. If let's say you're like struggling to open your blouse and your bra, and they get very impatient and they don't want to breastfeed anymore, so you have to be quick and fast, right? Next is try to explore different positions and different environment as well. For example, if all the while you have been breastfeeding your baby in a cradle hold, then maybe you want to try certain other positions like cross cradle, or maybe in a lying down position. So try to be more adventurous in other positions. And for bigger babies, like I've said earlier, they are more curious with the surroundings, so try to breastfeed in a more quiet room, right? You can go to like a romantic kind of feel, you know, like a dimly lit room. Put your bedside lamp on, okay, with the temperature which is just nice, like a very comfortable couch. You can put on some light music or some aromatherapy if you want. Okay, and then turn off all the unnecessary noise. Okay, like TV or radio, or some noisy toys, or in fact if you have older children, then try to make them to play somewhere else. So have a very nice, comfortable one-on-one time with your baby, and see whether that works, right? Next is you need to have a lot of patience as well. Again, it's easier said than done, but you know, when you're struggling and trying to feed your baby, try not to show your emotions so much that you're frustrated or even angry, you know, because baby can sense how you feel. Okay, so try to be as calm as possible and don't scold the baby. And if let's say you feel very stressed, then you can hand over the baby to someone else, or maybe you can just hold the baby and do skin to skin contact, and after the baby is showing some feeding cues, you can try again. Okay, baby will always try and tell you when they are ready. All right, and then yeah, again, if let's say the baby doesn't want to breastfeed, don't like force the feeding. Okay, like hold the head and shove it to your breast. Okay, so that will just make things worse and baby will just refuse to breastfeed. Okay, next is you can try doing this instant reward technique. Instant reward technique is like you're trying to show that hey, this is how you get milk, which is to suckle on my breast. Okay, so what you can do is before the feeding itself, you can use you can pump manually or using a breast pump until you can feel the let down reflex, and then let the baby latch. So at that time the milk flow will immediately be there. Okay, and next what you can try is when the baby is breastfeeding, you can like drop a few drops of milk on the nipple using a syringe or a dropper. Okay, so you can just put it at the side of the baby's mouth. So as the baby is breastfeeding, then the baby will get a taste of the milk as well, so baby will be happy and to continue breastfeed as well. So alternatively, you can use a supplemental nursing system or SNS. You might have seen it before. I will try to put a photo of it in this video as well. So another thing, if let's say you're using a nipple shield, for example mothers who are having a inverted nipple, you can fill up the tip of the nipple shield with some milk first, and then let the baby suckle. So the baby will be very happy because immediately there's milk there. Okay, so these are the methods that we use for relactation as well. For example, mothers who haven't been breastfeeding for a long time or taking adopted child and all that, so we opt for these tactics as well. All right, so that's all. Take home message is be patient. Again, be patient. Remember the benefits of breastfeeding, keep on trying, and yeah, if let's say baby is still refusing to breastfeed, then you have to bring your baby to see a doctor, because we're worried that the baby might be ill and not well, and worried if the baby is not receiving any milk, then maybe the baby will be having low blood sugar and all that. Okay, so you have to get your baby checked as well. And in the meantime, remember to express your breast milk to get your milk supply going. Okay, with that, that's all. Thank you. Bye.